Medical frontliners are at front and center in the fight against the coronavirus, risking their lives in dealing with the deadly disease. That is why the government is giving full support by supplying them with personal protective equipment or PPE sets. The health department says a complete set has an N95 mask, coveralls, gloves, head cover, shoe cover, goggles, surgical mask, and surgical gown. It bought 1 million sets worth 1,800 pesos each. PPE donations also poured in for both private and public hospitals, including St. Luke's Medical Center in Taguig and Quezon City. The hospital denies reports on social media that it is charging patients for donated PPE sets.
Clarify the usual charging of donated personal protective equipment to our patients. The hospital does not charge anything to our patients on any donated item.
St. Luke said frontliners assigned in common areas used the donated items. Health workers caring for COVID-19 patients used the hospital supply to make sure that the PPE sets pass the hospital's infection control standards.
We do have a special team headed by an executive of the hospital when it's managing all donations. So, iba yung storage area, isa sariling group sila na nag-handle doon, and then the donated PPEs are somehow given to our healthcare workers who are on the floors, like the housekeepers, so frontliners as well.
At the Los Santos Medical Center, a private hospital in Quezon City, donated PPE sets go to resident doctors. Nurses and attending physicians are using the hospital supply. Each set costs an average of 2,000 to 5,000 pesos. Its chief medical officer said charging patients on the use of hospital supply is part of the policy of private hospitals.
What is being charged to the patient is for the PPEs that are used by the nurses. Because we do not give the donated PPEs to our nurses, so the nurses and attending consultants will be using the PPEs which is coming from the hospital. In private hospital, everything that you use, no?
Is being charged.
Kunyari, mga gloves, mask, cap, sina-charge talaga yun sa patient. Hindi naman pwedeng free yun.
CNN Philippines also obtained a copy of a hospital bill of a COVID-19 patient who recovered from the virus. He was confined for 6 days in another hospital in Manila. The patient said he was billed for at least 3,000 pesos for the PPE sets, but he doesn't know if this were donated. Amid allegations of supposed fees for donated protective gear, some private hospitals deny earning from donated supply. In a statement, the Makati Medical Center said, quote, all donations to Makati Medical Center, particularly personal protective equipment including masks, gowns, coveralls, gloves, etc., are provided to admitted patients at no extra charge, end quote. The Cebu Doc group of hospitals also refutes claims it is charging patients for donated medical gear. At the government-owned Philippine General Hospital, patients in its pay ward pay for protective gear bought by the hospital. PGH spokesperson Jonas Del Rosario says this will ensure the PPE sets are of high quality. Charity ward patients do not pay for them.
Tuloy-tuloy, malaking bagay po yung donation. Although we are very strict about the quality. Okay, so syempre, well-meaning donors will send their what they thought would be good enough. So some are not medical grade, but for those who are really our healthcare workers who are directly involved in taking care of our COVID-19 patients, they have to wear the best PPEs. And that's the reason why we have to buy high quality ones because we want them to be protected.
PhilHealth says it will shoulder the cost for the PPE of a COVID-19 patient as long as it will fall under the package or budget. Transparency, accountability, and making sure that there are no abuses amid the coronavirus pandemic. Some private hospitals have already expressed their gratitude for the outpouring of support in giving protective gears to medical frontliners. They also said that donations will be spent wisely. The Private Hospitals Association of the Philippines also said that donated medical supplies should never be charged to a patient. Tristan Nodalo, CNN Philippines.